All right, so we're going to move on to beyond musculus uvulae to tensor vili palatini, and I think it's such a fun name to say, tensor vili palatini. So you'll see it right here. Okay, so here's a posterior coronal view. There's the tensor vili palatini. Okay, and it's really so the insertion is that palatal aponeurosis that we talked about. Um, and then it also attaches to the lateral aspect of the eustachian tube, and the eustachian tube uh, is basically a tube from your middle ear to the back of your throat. So when it tightens, or sorry, when it contracts, it dilates the eustachian tube. So it's a pretty cool thing. Tensor vili palatini. So when you're clearing your ears, um, you can think your tensor vili palatini. All right, and then we have palatal glossus. Okay, and you'll see it right here. And palatal glossus is actually called your anterior fascial pillar as well, or forms your anterior fascial pillar. And it's this guy right here. So when you look in the mirror, you should see kind of two arches, one here and then one here, and you'll see your tonsils between them. This muscle right here is your palatal glossus. So you can get a mirror now too if you want and take a look at that. But when this muscle has two functions, so it either elevates the tongue if the velum is contracted, or it depresses the soft palate if the tongue is contracted. So it's two jobs. All right, then we have palatal pharyngeus. Okay, that's the posterior fascial pillar. Okay, that's that second arch. And when you have a patient, say you're trying to stimulate their swallow or check their gag, you're gonna touch their posterior or anterior fascial. Usually their anterior fascial pillar, unless you really can't elicit anything. And that's if you like to, and that's if you're a therapist who likes to test gag. So anyway, oh, went too far. Get to tapping and I lose ya. So when that muscle contracts, it either is going to narrow the pharynx, which is your throat. It's another word for throat, but it's the superior aspect of your pharynx, or lower the soft palate. Okay, so here's that mid-sagittal view here of the palatal pharyngeus. Here's your velum. Okay. All right. So here are the fascial pillars, like I was telling you guys about. So here's the anterior fascial pillar. Here's the posterior fascial pillar. So palatal glossus, and just remember your tongue is more anterior than your pharynx, because your pharynx is back there, right, in your throat. And that's how I remembered that my palatal glossus is my anterior fascial pillar, whereas my palatal pharyngeus, remember pharyngeus is more posterior, is my posterior fascial pillar. All right, now we get to move to muscles of the pharynx, specifically the pharyngeal constrictors and elevators. Uh, and so you'll see there's a number of them, and it's pretty exciting actually. So the first one is your superior pharyngeal constrictor, and these are sheet-like muscles. Okay, and basically your pharyngeal constrictors really help with swallowing and with resonance. So if you're saying you're doing a high-pitched E, for example, you would use the superior pharyngeal constrictor to narrow that airway or that opening. So it pulls the pharyngeal wall forward and constricts the pharyngeal diameter. So it narrows the diameter of the pharynx when it contracts. That's this guy here. Okay, and then we have our middle pharyngeal constrictor. Okay, it does the same. It doesn't pull anything forward, but it does narrow the diameter of the pharynx. Okay, so just constrict. When it says pharyngeal constrictor, it's telling you exactly what it does. It constricts the pharynx. Okay, and it tells you where it is. I'm the superior one. I'm the middle one. I'm the inferior one. Okay. The computer is loving PowerPoint. All right. Okay, now we get to move to our inferior pharyngeal constrictor, and so you'll see it's actually broken into two muscles, and I think we do get into that, but it also reduces the diameter of the lower pharynx. Okay, so we do break it down. So the inferior pharyngeal constrictor is broken into two muscles: the thyropharyngeus and then the cricopharyngeus, we just refer to as the CP as well. So the cricopharyngeus is actually the very top part of your esophagus. So this is anterior over here, this is posterior, and it's a lateral view of your larynx. So here's your trachea, here's your esophagus down here. Okay. So this is actually a sphincter that's tonically contracted. It's always closed until you swallow. And when you swallow, you actually elevate this whole complex up, and it opens up this sphincter. And it also is innervated to, it's, when you can tell that muscle to relax. But in its rested state, it's constricted, so it's closed. Okay, so that's the cricopharyngeus. And then we have the thyropharyngeus, okay, which is right here. And its primary job is really to do that constriction of the lower pharynx. Okay, we just break it into two because this cricopharyngeus has a much different job. All right, and then we have the salpingopharyngeus. So here's that posterior coronal view. Here's the tongue, the epiglottis. Here's your uvula, your velum. This is actually your nasal cavity up here. Okay. So its origin is the lower margins of the eustachian tubes, and then it converges with the palatopharyngeus muscle. Okay, and it elevates the lateral pharyngeal wall. Okay, so the next muscle is the stylopharyngeus. So it's this muscle right here. Think of it's nice and thin like the styloid process, and it elevates the pharynx and opens the pharynx. So it's a little tiny stringy muscle. So here's your stylopharyngeus, and then here's your salpingopharyngeus, just to give you guys some orientation. All right, so here's cavities of the vocal tract. We have many of them. So here is your nasal cavity. So this is a mid-sagittal view. Here's anterior, here's posterior. Okay, so here's your hard palate. So this is your nasal cavity. This is your oral cavity. And then then we break the pharynx, which is all this area down here. From here to here, we break it into three sections. We call it the nasopharynx, next to the nose, right, the nasal cavity. The oropharynx, which is close to the mouth. Remember, oro, are the same thing. And then laryngopharynx, which is close to the larynx. So just know this is all pharynx, and then we break it into regions depending on what it's closest to. Is it closest to the nose, the mouth, or the larynx? And then here's that buccal cavity that I was telling you guys about. So here's a coronal view. And here's your molars, here's the buccal cavity, here's your buccinator muscle, this is the tongue. All right, and then we have our velopharyngeal port. So here is a sagittal view, anterior here, posterior here. Here's the velum. And then there's a port between the nasal cavity and the oral pharynx, which is right here. It's the velopharyngeal port. And when the velum actually closes that port off, so you'll see here. Okay? That's the velopharyngeal port. So what I'd like you guys to do, and if you can do it, I mean, obviously you're watching this on your own, but if you can get with a classmate and just kind of try to identify structures that you learned in this lecture, it will really help you consolidate the material. So I recommend that you get a flashlight out and a tongue depressor, and really kind of, or even just a mirror, and look at your structures. Find your fascial pillars, your buccal cavity, your oral cavity. Look at your dentition and count your molars. Count your molars, your bicuspids, your cuspids and incisors. Really make different facial expressions. Really explore the material, and it will stick with you. So I really encourage you to do that. And here's a list of the things I'd like you to find. All right, I hope you guys enjoyed that, and have a wonderful weekend.